There's a quiet moment that happens inside your body every single day, and almost nobody feels it. Your blood vessels tighten, just slightly, not enough to cause pain, not enough to make you stop what you're doing, just enough to increase the pressure pushing against their walls. At first, your body handles it. Your arteries stretch, your heart adjusts, your kidneys compensate. But over time, something begins to change. Those vessels, once soft, flexible, almost elastic, start to stiffen. The inner lining becomes irritated. Microscopic damage begins to form. Not all at once, not dramatically, just small, repeated stress, day after day. And here's the part most people never realize: your body starts adapting to this higher pressure as if it's normal. You don't feel it, you don't notice it. But inside, your heart is working harder than it should. Your brain is receiving slightly less efficient blood flow, and your kidneys are slowly being pushed toward exhaustion. Now imagine this continues for years. No symptoms, no warning signs that feel urgent. Just a silent process unfolding beneath the surface, until one day it's no longer silent. And this is where many people are told something that sounds reassuring, but isn't the full story. They're given a prescription, a pill that lowers the number, and yes, it works. The blood pressure reading improves. But what if that number dropping doesn't always mean the underlying problem is truly being fixed? What if in some cases, the body is simply being forced into a lower pressure state without addressing why that pressure was rising in the first place? And even more importantly, what if there are better ways, often overlooked, that can support your blood pressure at its root, not just mask the number? This is where things become very important, especially if you're over the age of 45, 50 or beyond. Because as we age, the systems that regulate blood pressure become more sensitive and more vulnerable. Your arteries lose some of their natural flexibility. Your nervous system becomes more reactive to stress. Your kidneys, one of the most important organs for controlling blood pressure, may not function as efficiently as they once did. And at the same time, many people unknowingly adopt habits that slowly push their blood pressure higher, not dramatically, not overnight, but gradually, consistently, silently. And so, medications become one of the most common solutions. In fact, blood pressure drugs are among the most prescribed medications in the world. But what most people are never fully told is how these medications actually work inside the body and what they don't do. Because once you understand that, everything starts to look different. Let's start with one of the most commonly prescribed types. These medications are designed to relax your blood vessels. They work by interfering with a system in your body that naturally tightens your arteries. On the surface, this sounds helpful, and it is. But here's where it becomes interesting. This system exists for a reason. It helps your body maintain blood pressure when you stand up, when you're dehydrated, or when your body is under stress. So when this system is constantly suppressed, your body sometimes compensates in other ways. You may feel lightheaded, fatigued, occasionally even experience subtle changes in kidney function over time. Now, for many people, these medications are necessary and beneficial. They can reduce the risk of stroke and heart attack when used appropriately, but they don't necessarily address why your blood vessels were tightening excessively in the first place. And this is where many people unknowingly make a serious mistake. They assume that once the number improves, the problem is solved. But inside the body, the underlying drivers may still be active. Inflammation in the blood vessels, chronic stress signals from the nervous system, excess sodium sensitivity, poor metabolic health affecting how your body handles blood sugar and insulin. All of these can continue quietly even while the medication keeps the number under control. Now there's another group of medications that work in a different way. They help your body release excess fluid by increasing urine production. This reduces the volume of blood in your system and lowers pressure. Again, this can be very effective. But here's what many people don't realize. Along with fluid, your body may also lose important minerals, like potassium and magnesium. These minerals are essential for proper heart rhythm, muscle function, and even blood vessel relaxation. And over time, if they are not replenished properly, subtle imbalances can begin to appear. Fatigue, muscle weakness, occasional irregular heartbeats, not always severe, but enough to affect how you feel day to day. Then there are medications that slow down your heart rate. They reduce how forcefully and quickly your heart pumps. This can lower blood pressure, weight how fines, and it can also reduce strain on the heart. But for some individuals, especially those who are active or trying to stay active as they age, this can create a different experience. Lower energy, reduced exercise tolerance, a feeling of heaviness or fatigue that wasn't there before. And again, the number improves. But the deeper question remains, what is driving the pressure in the first place? Because here's where things become even more surprising. In many cases, the root cause is not just one factor, it's a combination of small daily influences that slowly shift the body out of balance. For example, the stiffness of your arteries is heavily influenced by inflammation, and inflammation is often driven by diet, sleep quality, and chronic stress. Your nervous system plays a powerful role as well. If your body is constantly in a low-level fight or flight state, your blood vessels remain slightly constricted, your heart rate slightly elevated, your pressure consistently higher than it should be, and this can happen even if you don't feel stressed in a traditional sense. Then there's insulin resistance. When your body struggles to manage blood sugar effectively, it affects how your kidneys handle sodium, how your blood vessels respond, and how your hormones regulate pressure. Now, this is the part most people have never heard before. Improving these underlying systems can, in many cases, support blood pressure more effectively than people expect. Not overnight, not instantly, but gradually, powerfully, and at a deeper level. For instance, something as simple as improving your vascular flexibility can make a significant difference. And one of the most effective ways to do that is through consistent movement. Not intense exercise, not exhausting routines, but regular steady movement that encourages blood flow, signals your vessels to relax, and improves the health of the inner lining of your arteries. Walking, when done consistently, can begin to restore some of that lost flexibility. Now combine that with proper hydration. Many people are slightly dehydrated without realizing it, and when your body lacks fluid, it compensates by tightening blood vessels to maintain pressure. Simply supporting your hydration can reduce that unnecessary tension. Then there's the role of minerals. Magnesium, potassium, and even calcium play critical roles in how your blood vessels contract and relax. Foods rich in these nutrients, like leafy greens, nuts, seeds, and certain fruits, can support the very systems that regulate your pressure naturally. And this is where nutrition becomes more than just calories. It becomes information for your body, signals that tell your blood vessels to relax, your nervous system to calm down, your metabolism to function more efficiently. Sleep also plays a larger role than most people realize. During deep sleep, your body resets key systems involved in blood pressure control. If your sleep is fragmented or insufficient, those systems remain slightly dysregulated the next day, and over time that contributes to consistently higher readings. Stress, of course, cannot be ignored, but not in the way people usually think. It's not just about eliminating stress, it's about teaching your body how to come out of it. Simple practices like slow breathing, quiet time, or even stepping away from constant stimulation can shift your nervous system back into a more relaxed state. And when that happens, your blood vessels respond almost immediately. They soften, they widen, the pressure begins to ease. Now, none of this means medications are unnecessary. For many people, they are life-saving and essential. But the real opportunity lies in understanding that medications are often just one piece of the puzzle, and when you support your body from multiple angles, something remarkable begins to happen. Your blood vessels become more responsive. Your heart doesn't have to work as hard. your body starts to regulate itself more efficiently. And in some cases, under proper medical guidance, people find that their need for medication changes over time. But even when medications remain necessary, these lifestyle shifts make them work better. They reduce the burden on your system. They support your long-term health in ways a single pill simply cannot do alone. And perhaps most importantly, they give you back a sense of control because your body is not passive. It is constantly responding, adapting, trying to protect you. And when you give it the right support, through movement, nutrition, rest, and awareness, it begins to move back toward balance. That silent pressure inside your vessels, it doesn't have to keep rising unnoticed. It can be influenced, it can be supported, it can be guided in a healthier direction. And the sooner you begin paying attention to these small daily signals, the more you protect not just your blood pressure, but your brain, your heart, your energy, and your independence in the years ahead. Your body is always communicating with you. The question is, are you listening closely enough to what it's been trying to say?